As a pre-transplant coordinator, my role is to ensure that all of the patients get worked up prior to transplant and then getting them listed. So that entails seeing patients during their evaluation process, staying in contact with them after that to ensure that they get all of the workup done, and then making sure that they get listed so they can actually get transplanted.
Transplant surgery can be, going through the evaluation for transplant can be very confusing and very daunting. And as a coordinator, we are kind of the point person for the patient. You know, it's our job to facilitate them, you know, in any way needed, you know, to help them get through the process and actually into the operating room to get transplanted. So we are the first person that they call, and it, you know, the question may be a financial question, a question about their insurance, or you know, other questions about, you know, transportation or anything that may come up. They call us first, and if we can't answer it directly, then obviously we will find the answer for them. You know, we do deal with the scheduling of all of the tests that are involved. For living donors, you know, we tell our donors it is the most in-depth physical examination you will ever have. And the reason for that is because, you know, we have to guarantee that we're not going to put the donor at risk by having them donate a kidney to someone else. So, and it's not just at risk through the surgery. You know, we want to make sure that, you know, 5 years, 10 years, 20 years down the road, this person is not going to incur any other additional medical risks because they, you know, were so kind and generous to donate a kidney to someone else. My role in the transplant process here at the university is very specifically dealing with donors and recipients that are not compatible and cannot donate directly to each other. But I also work with the entire living donor staff for all recipients who have living donors, facilitating them through the process to actually get to be transplanted. The living donor process would start with the donors, the recipients coming in for their evaluation, donors volunteering to donate a kidney, and they fill out a donor questionnaire, which is reviewed by our team. They go through blood testing to see if, in fact, they would be compatible. If they are compatible, then we help them through the whole process, all of the testing and scheduling and whatever else may be needed to get them ready to go into the operating room for their surgery. If they're not compatible, then we offer them the paired kidney exchange program, which is a wonderful way for recipients to be able to receive a living donor kidney even though they can't receive it directly from their loved one. That works. The way that program works is that we take pairs that are not compatible and put them into different databases and which have pairs in similar situations from all around the country. So we're able to transplant people that otherwise wouldn't normally be able to get transplanted with a living donor kidney.
My role in the transplant process actually begins when the patient is transplanted, when they get their new set of lungs, throughout their entire lifespan. So Sharif and I, who is the other post-lung transplant coordinator, are very involved with our patients, and we actually almost serve as a primary care for our patients. We are involved with them with everything, including diabetes management, blood pressure management, to, of course, their lung transplant management of their immunosuppression medications. So it's very involved, but we enjoy working with the patients.
If I have a patient that I am helping to work up for a liver transplant, it's kind of the same thing where I am providing them with all the information on what to expect if they're going to have a liver transplant. I help get them set up for all of their testing to get them what we call medically cleared to be able to have a liver transplant. We provide emotional support along with our social work team. We will take care of them again after they've had their transplant as well. So it's a nice continuum. We meet them at the time of evaluation. We help get them worked up and listed for the transplant. We maintain them on the transplant list with basically just ongoing lab work. But if the patient's getting sicker, we're well involved with getting the patient here to Maryland for any further medical management. But then we take care of these patients after they have their liver transplant as well. And we're also in charge of being on call. So what that means is that when we have a donor become available, we are in charge of the list of people where we are the person making the phone call to the family and to the patient asking them to come in for their transplant. So it's kind of a neat job in that regards too. We have a big job.